1/5 of the nation's economy. That's the size of the challenge ahead for progressives. They want to maneuver the U.S. healthcare system, currently 1/5 of the nation's economy, to a single-payer system. For starters, Democrats in Congress and across the country would need to undergo a massive Reagan-like political shift to get the votes to accomplish such a feat. So, say that shift happens. What are the obstacles the government would need to surmount to make this plan happen? A single-payer healthcare plan would mean a complete transformation of every aspect of our healthcare industry. Advocates say Medicare for all, but their plans would revamp and expand the popular program that now covers seniors. The government would become everyone's insurance provider, which is why this concept is sometimes called a nationalized healthcare plan. Hospitals and doctors would see a new payment system. The insurance industry would shrink to a fraction of its size, and the government would be responsible for gathering drug companies around a price negotiating table. It's more than likely a single-payer system would necessitate the birth of a new government program to pay for and chaperone the new system. How would that new agency pay providers for their services? And where does the government pull the money to finance the program? These are all questions that lawmakers and a Democratic administration would need to solve if a future president chooses to push for a single-payer system. On the question of cost, some progressive proposals already have blueprints on where to find the more than $32 trillion to pay for a plan. But Washington would also have to hurdle the complicated task of picking a compensation rate for providers, a herculean balancing act of conflicting goals, controlling healthcare costs, and maintaining quality. Unraveling our current insurance system is also a Gordian knot all on its own. Moving to a single-payer system would pretty much eliminate most of the insurance industry, possibly leaving more than 1 million people without a job. Moreover, these obstacles are compounded by the quick transition periods proposed in Congress. Industry experts say a transition should be extended possibly over a decade, but some politicians pitched a 2-year changeover to give the industry less time to push back. To recap, progressives would have to come to a consensus on a plan, get a Democrat-elected president, and overcome all of the obstacles of shifting an entire industry.